Welcome everybody, thank you for inviting me. It's absolutely lovely to be here, but I'll just correct you, it's nutrition and food sciences. So you said nursing.
Oh,
yeah,
I apologise.
That's okay. So I'm also an accredited practicing dietitian and I've worked clinically as well as doing research and obviously teaching in the past. So what I want to do is look at both the prevention side, the treatment, and then the after treatment has finished for the survivors. So just initially looking at prevention, and I'm drawing your attention to this slide, and it's a very busy one, and it's from the World Cancer Research Fund, and many of you may have come across it before. But what they've done is bring together all the evidence regarding lifestyle factors and the risk of getting cancer. And these are generally across all areas of cancer and not specific to any one type of cancer. And you can see a lot of these things are what we've probably heard of before. I'll just make sure I get the pointer. Be at a healthy weight, be physically active, eating a diet which is really rich in the plant-based foods, that's whole grains, vegetables and fruits, limiting our consumption of fast foods or other processed foods. And the problem with these is they're high in salt, saturated fat, and also sugar. Limiting our consumption of red and in particular the processed meat like salamis and hams and metwursts, limiting our consumption of sugar sweetened drinks, limiting alcohol consumption. This is a really important one that's often overlooked, and because of the amount of advertising regarding supplements, people don't consider it, but do not use supplements for cancer prevention, okay? The evidence is very, very limited that it offers any benefit whatsoever, and in fact, it could actually increase people's risk of getting cancer. So that's a really important one. For mothers, breastfeed your baby if you can. It offers protection both to the mothers and the babies regarding cancer. And then after cancer diagnosis, follow these recommendations as closely as you can. And we're going to look at a little bit more closely at that. So prevention. Many foods and behaviours have been linked to cancer, but what the World Cancer Research Fund is also looks individually at each of the different types of cancers, and what they found is that there's very limited evidence that there's any real lifestyle factor that's a causative factor for brain cancer. So that's an important thing to remember, but we are always trying to reduce the risk of all types of cancers and other chronic diseases. So, nutrition during treatment. As a dietitian, we have several aims that we're looking at. And the first one is to reduce the risk of other health problems. So we don't want people being at risk of heart disease or diabetes during treatment as well. So that's a really important consideration. The second one is to maintain weight. Maintaining weight is really important. And so if there's any loss of weight, that should trigger a request to see the dietitian in the supporting unit that you're with. Maintaining your strength and energy to allow the normal activities to proceed, such as the physical activity, which is really important. Lowering your risk of infection from other diseases, and you know, we're all going through COVID now, and we know how important nutrition is for immunity. Aid healing in the recovery process, and also reduce the side effects of other treatments, that you might be undergoing at the time. So all of these are things that we will look at when we're seeing people who are receiving treatment, and different things will be of priority for different people. So, in regards to the symptoms of treatment, they can be quite difficult for people to deal with, and sometimes we are able to help through nutrition and food. So some of the symptoms include fatigue. With fatigue, you often probably don't feel like preparing a meal. So the important thing is to get your family and friends there to help with the supply of safe foods. If that's not possible, using meal services, and there's a whole lot of them that are out at the moment, such as HelloFresh, Marley Spoon. I don't have shares in any of them, they're just the ones I remember off the top of my head. Also, frozen meals could be effective for those difficult days where you don't feel like doing something. Nausea and vomiting are also a common side effect of the treatment. And different things will work for different people. So, you know, certain smells of foods may trigger nausea or vomiting, so avoiding those. Eating small, frequent meals is also a really good thing, and also helps to maintain your energy intact during the day and minimise any weight loss. Reduced appetite can occur because of the treatment or the nausea. Once again, going for food that looks appetizing, small serves once again. It's a bit overwhelming to be faced with a large plate of food when you're undergoing treatment. So make the serves smaller and appealing and more frequent. Taste changes can also occur with the treatment. So people report often that food tastes a little bit metallic or they can't taste it. One of the things that we get people to do is actually rinse their mouth out with water before they eat, so that that can freshen and get rid of any of that sort of, medication that might be coming through. So rinse your mouth out with water a few times before eating and see if that helps. Now I've got the others asterisk, and that is if you're suffering from these, it's best to get dietetic input from the dietitian in the unit. So diarrhoea, constipation can be as a result of the treatments, and it can fluctuate between one and the other, and it's probably best to let your doctor know about it, let the dietitian know about it, and specify, and they can be really specific about how they treat it for you. Also, if there's any swallowing problems that occur, once again, get the dietitians involved. It may mean that we need to alter the consistency of your food for a period of time. And to do that, we also need to make sure we supplement and make sure it's really high energy so that it sustains you. So that's another important thing. And of course, weight loss. Once you start losing weight, it's really important to get the dietitian on board to help you with that. So do seek help from the health professionals to help you through this. So other concerns that people have: what if I'm vegan? Can I continue eating being vegan? Is anyone here vegan or vegetarian? No? Oh, yep. So what do you do? Well, there are some risks with being on a vegan diet, and these risks occur even for people outside of getting cancer. And this is the level of protein in the diet and the type of protein in the diet. And normally, if you're not eating any animal foods, you're not getting that high quality protein that contains all the amino acids that we need. So vegan diets are a lot better now than they were 20 years ago. So the important thing is to make sure you mix your beans, mix your grains, so you get all of the amino acids. The other three nutrients of concern are iron, calcium, and vitamin B12. Iron and vitamin B12 will definitely make you feel more tired if you're not getting enough of them in your diet. So really looking at getting foods that are supplemented in this. So breakfast cereals are a great one. They often have iron and vitamin B12 added. Or if not, talking to your doctor and seeing if you need a blood test to see what your levels are like, and then going on to supplements. Calcium, it doesn't have any immediate day-to-day effects, but it's more the long-term effects from reduced bone density. And some treatments also affect bone density, so it's important to make sure that if you're using those plant-based milks like soy, almond, oat, there's a whole lot of them available on the market now, that they are supplemented with calcium. Okay, that is really critical. Other people may be doing different diets due to religious observations. So we've just had the period of Ramadan, and that can severely affect someone's ability to get enough food in. In these circumstances, often people can get special permission to not follow these diets during the time they're getting treatment. So I urge people to investigate that and make sure they have their nutrition as their prime aim. Okay, so people ask about organic food. Is it better? Well, there's very little evidence, surprisingly, that organic food will actually reduce your risk of getting cancer, except in non-Hodgkin's lymphoma. Yes, organic food does have less pesticide in it if it comes from a bona fide organic farm. But just to point out, the fruit and vegetables that we have in our supermarket undergo really strict regulations for the amount of pesticides they're allowed to use. So they are perfectly okay, and washing them will get rid of a little bit more as well. The other risk is that organic foods may have more microbes on them. And in some cases, people are asked to have a food-safe diet where they reduce the microbes that they're consuming through their food. So that's the risk with organic food. The other risk is if we keep saying to people organic food is best for preventing cancer and during treatment, is most people won't eat enough fruit and vegetables, okay? Organic fruit and veg are a lot more expensive, and most people, well in fact only about 5% of the population eat enough fruit and vegetables, according to the AGHE. So if you then tell people on top of that, oh well it's got to be organic, the usual type is no good for you, it's going to further reduce intake. So having enough fruit and vegetable is way more important than whether it's organic or non-organic. People ask about the ketogenic diet. This is based on the theory, and theory means it hasn't been proved yet. Okay, so let's remember that. The theory that brain cells use keto bodies for energy, which they do. It's the way that the body's evolved to allow us to still have an energy source for our brain if we're not eating carbohydrates. But it appears that the cancerous cells may prefer the glucose and they're unable to use the keto bodies. So therefore meaning that more of the cancerous cells in the brain may die. That is the theory. Okay, I keep saying that's the theory. And it limits the survival of them. And if we look at the evidence and a systematic review and meta-analysis that was published really quite recently, and systematic reviews is a way of bringing together all the evidence on that one topic and analysing it in a very systematic and objective way. And what it found was it's not suitable with the current evidence and that weight loss occurs with this diet, okay? So, just to break it down, in this systematic review, one study showed a slight improvement in survival rates, but a very weak link they showed with that, and only analysing it for 3 months. So it's not what we call a good quality study. Those that looked at adherence, there was low adherence to the ketogenic diet. So most people found it difficult to deal with. Weight loss was seen in 3 of the studies. Quality of life was reported to be worse, and I understand that because I really like pizza, and I'm sure most people do, right? So pizza would be off if it was on the ketogenic diet. And there were also more adverse events like nausea and vomiting. And that's because a keto diet makes you feel more nauseous anyway. It also makes you a little bit more grumpy, so another good reason not to consume it. The other thing that hasn't been tested is if you're depleting a whole food group in your diet, you're missing out on a lot of fibre that keeps your microbiome as healthy as possible. So we suspect that your microbiome will also be affected to be a less healthy one. We've heard a lot about microbiome in the media lately, and it is important that we feed it and we need to give it the fibre from those grain-based foods. Fasting, once again, they're talking about normal cells aren't affected by chemo in fasted state, but the cancerous cells are. Once again, it is just a theory. There have been very few good quality studies that have been conducted, so it's definitely not recommended. Some say there's reduced symptoms, but that might be because you don't experience the food-associated nausea when you see the food. So once again, not at all recommended. What is recommended? I've talked about what's not, but you probably guessed by my slides, what have people noticed? That my pictures on my slides. Lots of vegetables and lots of colour. Colour is so critical in your diet. It sounds very kindy-like to say eat a rainbow of foods every day, but every different colour in your vegetables represents a different nutrient that we know of and many that we don't know of yet. Nutrition is a very new science. We don't know what's in all of our food. So the more colours you consume through fruit and vegetables, the more of these beneficial nutrients that you will get. And they all have a role to play in healthy bodies, in helping your body defend yourself against infections, and also protecting your body during the cancer treatment. Also the prevention, so really critical. Colourful plant-based diet with lots of veggie and fruit. Here in Australia we say we need 5 serves of veggies and 2 serves of fruit. Other countries actually recommend higher levels of fruit and vegetable. So some countries go up to 9 or 11 because we know there's more benefit with the more fruit and vegetables you eat. So I can't emphasise how important it is. High nutrient density as well. Lots of nutrients, low energy intake. Consume the healthy fats, olive oil, avocado. They also have lots of other nutrients in it, apart from the fat. And I know we've gone through a bit of a fat phobe session, in the last 20, 30 years, but healthy fats are actually really good and protective, particularly those plant-based ones. Choose healthy lean protein sources. Your fish, your chicken. You can still have red meat, but try to reduce the amount you have every week. Recommendations are about 2 serves of red meat a week. And also introduce legumes, because they've got protein in them, but I've also got all those other nutrients in there that help protect your body. Big appetizing meals, small frequent meals, and don't waste fluids. If you're losing weight, don't drink just water because that's empty kilojoules. Have milk, have a plant-based milk, have a little bit of juice, have tea, have coffee. Enjoy those things as you can. So, nutrition after treatment, it's pretty much the same. Eat food, we say. And I don't know if anyone's heard of Michael Pollan.